Today we're going to talk about when therapy doesn't work. I'm going to talk about 8 different factors that can get in the way of therapy being effective for you, depending on what's going on either on your side or on the therapist's side. My name is Brandon Smith. I'm a licensed professional clinical counselor. I work in the state of Minnesota, and I am not here to provide medical advice to anybody, so make sure to reach out to your own therapist or your own medical doctor for specific information that would be helpful for you. All right, let's get into it. Number 1, biological factors can get in the way of therapy being effective. Many mental health disorders have some sort of biological component to them. Some of them almost exclusively really start as biological problems, like bipolar disorder or schizophrenia. Alternatively, other common disorders like depression or anxiety are known to sometimes have very biological factors involved. If biological imbalances or chemical factors are going wrong in your mind and that's what's causing issues, think of it like driving a semi on a windy day. It's going to be really hard to keep that semi on the road given how big and affected by the wind it might be. Think of how hard it might be to drive a semi to begin with. It's manual, it has a bunch of gears, it's already complicated enough, let alone having to keep it on the road with all that wind. So in this metaphor, I think of the wind as the biological factors. If we can address those with things like medication or other forms of medical treatment, then often we can cut the wind and just focus on driving the semi for what it is. As a therapist, I do not immediately urge my clients to go seek medical care or medical assistance unless it's a really biological disorder, like I mentioned, bipolar disorder or schizophrenia. Those must be addressed before therapy is likely to be effective, but for things like depression or anxiety or personality disorders, those are the kinds of things that I'm going to just start out with therapy and see what happens with my client, especially if they tell me they're resistant to medication. However, if we start running into problems and we're not making any progress in therapy, it's probably something I'm going to bring up and have a conversation about, and that might be your limiting factor. So consider, if you're not making progress in therapy, are you addressing any biological components that might be there? Number 2, the nocebo effect or confirmation bias, also what I like to call unwillingness. So if you've never heard of the nocebo effect, but you've heard of the placebo effect, it's the exact opposite of the placebo effect. For the placebo effect, if you're expecting things to get better, it is likely your brain will manifest that to get better. And these are real changes. They're actual biological mechanisms that can actually change things because of the placebo effect. It's been measured in research. But the same works for the nocebo effect. One of the biggest common situations where the nocebo effect has an impact is with medications and side effects. A lot of people will read the side effects before they take a medication, and then they'll start to notice those side effects show up, whereas people who do not read the side effects before taking the medication are much less likely to experience those side effects. This certainly applies to therapy as well. If you're expecting things not to work out in therapy, it's very likely that they're not going to work out at all. This is why I also relate it to confirmation bias. If you're only looking for the bad, only expecting bad things to happen, your brain will filter out any positive experience, ignore it, or get rid of it entirely, and just focus on the negative aspects of it. Therefore, your experience is likely to be favored as a bad experience. There are many reasons why a client might have some reservations to begin with certain skills or certain concepts in therapy. Often, some therapists or other people have not taught them what a particular skill or concept is specifically. I'll give 2 examples of the most commonly resisted concepts that I bring up in therapy: mindfulness and paced breathing. Most people misperceive mindfulness as being something related specifically to meditation. It's not to say that meditation is not an important part of mindfulness, but it's not actually the whole concept. Mindfulness has nothing to do with sitting down and doing some practiced exercise unless that's what you're doing to practice it specifically. But mindfulness generally is just paying attention in the present moment to something by choice. So many people have first experienced some really interesting or especially very spiritual types of meditation or guided meditations. I myself was once a DBT client, and I quit DBT just because I hated mindfulness. I very much disliked the spiritual nature of the meditations that they were using at the times. I felt it was ridiculous and didn't give me any practical reason to actually do it. I thought, what's the point of sitting here putting a raisin in my mouth and feeling it? That's not going to make me feel any better. But I didn't understand that the core effort of mindfulness is to build focus control. something that when you're just practicing probably isn't all that beneficial, but when you actually implement it or practice it, just like going to the gym and working out, eventually when you need that strength, you can call upon it. Pace breathing is another one. There are a lot of very interesting, unique, and kind of weird versions of pace breathing, and people really don't like that all that much. I like to break it down into its most simple form, breathing in a nice slow in breath and longer out than in. When I have clients practice that, it's a lot less weird and a lot more direct, and it's something that they can start to notice an impact in about 30 seconds to a minute. And certainly, I want to be aware of what my clients are struggling with and what they think the practical use of a skill or a concept is. And so I'm going to do some investigating. But ultimately, if we get to the point where you're just not willing to practice a particular skill, then I'm going to give up on that. But if it's something that you think in your wise mind might actually help you, I would just give it the best try you can several times just to get a really good idea and look specifically for any positives. Your brain doesn't have to work hard to look for the negatives or things that don't work. It does have to work hard to look for the positives. So if you're on purpose looking for the positives, it's more likely you'll find them. Number 3, not following through on the work that we assign outside of session. A lot of therapy has to do with what's going on in your life practically throughout the week when we're not even there. The therapy room is very cultivated to be calm and an easy place to sit down, talk about what's going on in a very relaxed way. So a lot of people will start to make progress in session, processing their emotions, digging into deep things, but when they go home, they're not actually practicing what we taught in session, particularly because it's a little bit difficult to actually apply it outside of session without somebody coaching you through it right then and there. However, as a good therapist, we want to make sure that you're practicing these skills and we teach it in a way that you tell us it's likely to work for you outside of session. But if we assign a homework assignment, you go home and you say you did it, but you didn't actually do it, it's likely you're not going to get any benefit out of it except when you're in session. And it'll be a weird feeling of I get into session and I feel so much better when I leave, but I don't practice anything at home. Therefore, I don't see any results at home. So it's very crucial that if you end up receiving homework or something like that outside of session, that you actually practice it. Ultimately, it doesn't benefit me at all to make a homework assignment for you. It's supposed to be for you to take home and actually experience something out of it. I'm not doing it because I want to get a grade from you and I want to see how much you're listening to me. I want to give you something that you're actually going to notice an impact outside of session. Number 4, lying to your therapist is unlikely to produce good results for you. Without accurate information on what my client is really struggling with, whether it be symptoms, functional impairments, or past traumas that have a big impact on what's going on today, then I can't target my therapies to what's actually going on for you. Sure, maybe there's some skills or certain concepts that you can apply outside of session, but there are a lot of things I don't cover unless I absolutely need to because it's relevant to your life. So there are a lot of concepts and a lot of skills that I might not teach just because I haven't heard something that applies to you yet. Maybe because you're not telling me exactly what's going on. Hopefully, it's not because as therapists, we're making an uncomfortable environment to be honest. But if your therapist is working really hard and you have a good relationship with your therapist and you're just afraid to talk about something, if they're a professional, they should be able to handle it gracefully, not judge you, and be a very safe person for you to open up and talk to. I'm not a lie detector. So if you come into my office and you tell me something flat out that's not true, I'm not necessarily going to call you out on it and pretend like it's not real. I probably have no idea what's going on in your life. And so whatever you bring into therapy, that's what we get. More than anything else, don't lie to your therapist saying that you're doing better when you're not. Ultimately, I don't want you leaving therapy and ending up worse off because you never got any benefits to begin with. And then you're just telling me, trying to make me happy, which me being happy has nothing to do with you reporting that everything is going grand and chipper. It's about you actually seeing real progress. And if you're not, I want to make sure I update and I actually do something beneficial for you. Number 5, I mentioned it just a moment ago, but we're talking about poor therapeutic relationship with your therapist. This is something where it's crucial for your therapist to make an open, safe, inviting environment for you to come in, talk about what's going on, not feel judged, and not feel like you're receiving advice for things that don't apply to you. Not to mention, research proves that therapeutic relationship is the most important aspect as to whether or not you're going to make progress in therapy. So if there's no established relationship and you're just going straight into clinical information, it's unlikely that any of that is going to be useful for you at all. Take into consideration how you feel with your therapist, and hopefully if they're a professional and you're not feeling comfortable for one reason or another, they're going to be open and willing to receive that information. I make that extremely important to the therapy I do with clients. I open up in every single session an opportunity for my clients to tell me how they're really feeling, what's going on, so that I can adjust as necessary. Or at the very least, if we're just not vibing and things aren't going well, I want to make sure to refer you to a therapist that you do have a good relationship with or could build a good relationship with. Sometimes it just comes down to a difference in personality. Sometimes it comes down to the therapist not doing their job properly. And ultimately, if you don't feel safe and comfortable talking to your therapist, even if you don't tell them anything, maybe it's time to look for a new therapist altogether. Number 6, is your therapist giving you advice? And I'm not talking about suggestions or talking about skills and ways that you can practice things. Direct advice in therapy is not appropriate, and that's basically telling you exactly what to do and how to live your life. Do this, do that, follow this recommendation, and you'll be okay. When I'm in therapy, I have no implication in making sure that you do certain things or don't do certain things. All I want to make sure of is that you're thinking through things properly and you're making decisions for yourself based on the values that are important to you. Now, if you experience this, I wonder if your therapist might be blending between being a therapist and being a coach. Coaches are a little bit different than therapists. I can't speak too much to what they do and what they don't do. All I know is that coaches can be a little bit more direct with the advice that they give to clients. So if you're receiving advice, consider whether or not you can open up a conversation with your therapist talking about options and opportunities and how to think about things, as opposed to direct suggestions on exactly what to do in certain circumstances or what to say to certain people. Number 7, your external world can't or won't change for one reason or another. Often a person's problems are not internal, but they could be very external in nature. It's not that there's nothing internal we can do to help you accept or move on or work with things that are difficult to change. But if you're going through situations outside of session that are big problems for you and you don't change them or you can't change them, I don't know that you're going to feel all that much better until the external circumstances update or change. If you're living in an uncomfortable environment, if you're living in a place where you can't trust people and what's going on, I don't know that we'll ever secure a sense of safety or feeling like things can be comfortable. Not until you get out of that environment or update how you're going about it entirely. I know a lot of people say sometimes you can't run from your problems, but ultimately, I don't subscribe to that. Sometimes you do have to get away from issues that are in your life and move on and don't even try to fix things if you don't have any control over them. If you're working with an awful boss, if you're working at an awful company, if you're working with people that are not trustworthy and they're invalidating to you, and there's no amount of skill that you've tried that has an impact on changing things, then it might be time to give up and move forward and actually cultivate a life worth living. So work with your therapist to consider what aspects of your life do you have more control over without trying to change things that can't or won't be changed. Finally, number 8, I want to talk about using substances in therapy. Using substances certainly creates another biological component that changes the dynamics of how therapy can be effective or not effective. Substances change how the brain works, how emotions are felt, and how thoughts are processed. And often our memory and actual functional learning can change depending on what we're using as substances. Even as little as caffeine can change the way that therapy operates. But we're talking bigger things like THC, alcohol, or other illicit drugs. Those can have a major impact onto whether or not therapy is going to have any functional impact whatsoever. So if you're coming into therapy using a substance, if I'm aware of it, I may talk to you about the issues related to it and how therapy may not be effective. And overall, if you're too altered altogether, I may just end the session and say, we need to come back together when you're sober. And that would be something where it's time to talk to an LADC or a licensed addiction counselor, as opposed to a mental health counselor, at least until you get the substance use under control. So those are the 8 different issues that can get in the way of therapy being effective for you. If you want to see more of this channel, please like and subscribe to the channel. I will be uploading more videos as we go along. I can't promise on a schedule right now, but I am going to try to do it a little bit more frequently, at least a couple a month if I can do it. If you have any specific mental health topics that you would like answers on, you can feel free to leave a comment down below, and I'd be willing to consider making video out of topics you guys suggest. Thanks for watching. Have a wonderful day. I hope you're all together all right.